About 35% of adults have pre-diabetes. And so in Houston, where we have a little over 2 million residents in Houston proper, that would equate to over 700,000 individuals with pre-diabetes.
There's a very large number of people that are at risk, and that ranges from ethnicity. And then there's certain lifestyle issues such as sedentary lifestyle, obesity, family members who've had diabetes.
When I found out that I was borderline pre-diabetic, it kind of shocked me into really thinking about changing the way that I eat, particularly because, you know, I do have some older relatives that have diabetes that lost limbs, and it just made me just say, okay, I need to change.
I was pretty concerned. I have a family history of some type 2 diabetes, and I was very not interested in going through that myself. Before I started the program, there was really not much that I did. My activity level was next to nothing. I did not watch what I ate. There was no real concern for my health at the time.
I exercised rarely, if at all, and just was kind of lethargic. And afterwards, I reduced the amount of sugar that I ate, tried to eat more balanced meals, and try to get some more exercise in.
The YMCA's Diabetes Prevention Program is an evidence-based program that helps individuals to prevent diabetes by helping them to engage in a healthier lifestyle, lose a small amount of weight, become physically active, and thus prevent type 2 diabetes.
It's a fantastic program that really allows people to individually tailor changes in their diet, changes in their physical activity, so that they can reduce their risk of having diabetes. The medical outcomes of having diabetes are so concerning and hard for people to live with, like heart disease, kidney disease, blindness, that it really is the best approach to try to prevent that in the first place.
The class is a year long from start to finish. The first part is 16 weeks where we meet weekly. Okay, so we call that the core session, and that's really where we teach a 1-hour class each week, and it's all about lifestyle change. So this is not a diet by any means. It's a lifestyle change program where we give you the tools that you need to learn how to live a healthy life. So the goal is weight loss, but we do it the right way. It's hard work, but it doesn't seem like hard work because you're fully equipped to do it. We track your weight because the goal is to lose at least 7% of your body weight by the end of that core 16 weeks. So you come and you weigh in, and then you have a seat. You turn in your trackers. Each person tracks their food and physical activity for the week.
Without the diabetes prevention program, I probably would not have lost as much weight so far. I probably would not have the motivation that I need to change my lifestyle and to get out of diet mode. It's not about a diet, it's about truly a lifestyle change. And just even understanding the effects of diabetes, I honestly did not realize it affects your heart. You know, I knew it affected your eyesight and, you know, amputations and, you know, things of that nature, but just learning. I honestly didn't realize that once you have diabetes, you basically have it for life. There's no cure for it, it's just managing diabetes, and I never realized that or thought of that before.
I've made a lot of changes. I've made considerable improvements in my activity levels. I watch what I eat a lot more. All of that, it's just changed so much to improve my life. Since I've exceeded my goal, I feel so much better physically. Before, I was in pain. I had a lot of hip pain, knee pain, ankle pain, and it was just so hard getting around. Having exceeded my goals, I physically feel so much better. You know, I get to play with my son now. He's about 6 months old now, and you know, it's just so much easier to get out and do things and be able to live life.